The country logs the lowest daily COVID cases in almost 2 months. 9,055 new cases were reported on Tuesday. This is the first time since August 10 that the daily tally dipped below 10,000. But the health department says the relatively lower count is due to lower laboratory output last Sunday. The latest bulletin also showed active cases or people currently sick dropped to 103,000, while 12,000 more patients recovered. No new deaths were reported due to technical issues with the data repository system. The health department refuses to declare that the COVID-19 situation in the country is improving. Spokesperson Maria Rosario says healthcare utilization rates nationwide remain high. This means that many hospitals are still congested with COVID patients. Majority of the regions also reported conducting fewer RT-PCR tests, with the biggest decline seen in Metro Manila. Now let's check the situation at the Philippine General Hospital. Joining us now is their spokesperson, Dr. Jonas del Rosario. Doctor, good morning. Thank you for joining us.
Gandang umaga, Ria.
Okay, Doctor, we're seeing relatively low daily cases. The count has been going down the past few days. But the DOH spokesperson, Maria Rosario earlier said, if the cases are going down, that's good, but we need to consider other things and see that hospitals are being decongested. Could you tell us what the situation is like in PGH and where is your current hospital utilization rate at?
Well, we still have a lot of patients in PGH. You know, our current number, we have 237 confirmed patients with COVID out of our 325 beds. So that's roughly about 75% occupancy. But we still have a lot of patients who are severe and critically ill, which makes our ICU beds always full. We still get a steady supply of walk-ins to the emergency room. And although our numbers, I have to admit, are much less compared to what we had about 2 weeks ago, wherein we had about as high as about 355 patients in our hospital. We are hoping that the numbers will progressively decrease because as long as we have more than 200 patients in PGH, our healthcare workers are usually really tied up in the COVID operations.
All right, so around 200 is sort of like your threshold, let's say, right, for not overwhelming your healthcare workers. So, you know, you said a few weeks ago in an interview that, yes, the ICU and emergency rooms were full. If a patient were to go to PGH now to be admitted for COVID, how long would they wait, if ever?
The wait is much shorter. One good thing about the situation now is the emergency room is not teeming with patients, and so they come in, they can be seen in the ER at least to be stabilized, where before they are not even allowed to go to the ER. So they can come to the emergency room as long as it's coordinated. And the movement of patients from the ER to the ward now is probably within 1 to 2 days they get admitted. So that's good. The only limitation we have is the ICUs are still quite full. And so those who are critical or severely ill, who might need intubation or high flow oxygen, might have to wait a little bit longer. But we're able to manage much better now compared to what we were experiencing 2 weeks ago.
Well, it's always good to hear that there's some level of improvement. Now, you mentioned healthcare workers. In the past, you said that you were understaffed, health workers were drained. How would you describe their morale at the moment, and are you getting help in terms of manpower?
Well, there was a time when we were really all exasperated. We actually had, we were running out of healthcare workers. Our doctors were getting sick, our nurses were getting sick. Some of them were leaving, but now we're able to manage more. We had this what we call task sharing, where in other departments, not only from the internal medicine, sent doctors to help, and I think this is working. And some of the doctors who got sick are now back to man the COVID ward, so we're able to manage much better. We're still hoping that we can get more volunteers or who can help us. These are paid volunteers by the DOH, and hopefully we'll get some generalists or specialists who can augment our manpower.
Doctor, can you tell us how many of the PGH healthcare workers are out sick with COVID or having to quarantine at this time?
Well, there was a time when we had about 100 healthcare workers who are out of commission because of either getting sick or being exposed and they needed to be on quarantine. Right now, there are probably just less than 20 frontliners that are out of commission because they're trying to recover or are waiting for their symptoms to come in. So it's a reflection also of what's going on in the community wherein the numbers are decreasing. And a lot of our healthcare workers get infected, not in the hospital, but in the communities.
Right. Now, one way of controlling the numbers, of course, is vaccination. And vaccination of minors aged 12 to 17 may begin this month. And reports say that PGH will be one of the first 3 hospitals where this will be offered. How are you preparing for the inoculation of this younger subset of the population?
As we speak now, the PGH administration and DOH are meeting on the details of who will be vaccinated, how many will be vaccinated, and the other details. So I can only tell you that, yes, we were informed that PGH will be one of the first hospitals to undergo this pilot immunization for kids 12 to 17. What we know is they would like us to vaccinate children who have comorbidities. And so we will be looking at our patients in PGH.
All right. Thank you for that. Always good to talk to you, PGH spokesperson, Dr. Jonas del Rosario.